right, it's an exciting one today. How does a CDI go about drafting queries? Queries. First of all, queries must be compliant, non-leading, leave room for the clinician to make their own judgment. You can make those multiple choice, yes or no queries, or open-ended queries. Some organizations send them through EHRs, sometimes free text via in-basket message, sometimes you'll deliver the queries in person, or sometimes they will still be written on paper. Now, to make your work super easy and seamless, you should always have Word documents and templates, which you will and should modify as needed per query. One of the worst things a CDI can do is send a templated query out to a clinician without first modifying it according to what's actually going on with the patient's clinical picture. Pretty much immediately, you're going to start losing credibility with your clinicians. Have scratch paper available. You're going to copy all the evidence from the chart, which you're going to use in your query. Say you're trying to validate hemiplegia following a CVA. You're going to copy in evidence that is leading you to believe that hemiplegia due to the CVA is active. Check this out. All right, so just an example of what your templates could look like. If you want to start off by referencing what was previously documented, or maybe you want to start off by referencing a medication, if that's what you have to lead with. Compliant query closing example. If there is a DX related to these labs and the condition is relevant to your visit, document and code diagnosis with status and plan. Or if you agree it's a DX related to these findings, and of course you only want them to document whatever was actually assessed within their visit, leaving it completely up to the clinician's judgment. And you want to have your multiple choice options available on hand, so you don't have to type these out every single time. Different types, only choose the conditions that are relevant to the actual patient. All right, so during your chart review, start copying over your evidence right away to help you save time and to make sure that you're staying organized. Name and MRN, CVA in 2021, excerpt from recent visit note, additional documentation from the HPI, and all the evidence that's leading us to believe that this is hemiplegia resulting from the CVA. The medication the patient's on, full support. Start by opening strong where we think it might have resulted from. Additional support, medication, and thankfully its indication is documented in the chart. Now we want to put a query closing and then your multiple choice options. If you don't have much space, abbreviate these a little bit. Patient, maybe you could put PT, dog 2021, uses walker. Just abbreviate things and make sure it's clear and concise. Also remember to put these options at the end. And a couple reminders, always be super respectful and professional in any and all communications with a clinician, whether it be your queries and your follow-up messages. Make sure that you're checking the details before following up about things, because there's nothing really more frustrating to a clinician than receiving a message about something they already did, or receiving a message from you that makes no sense, or taking time out of their busy schedule to reply to your messages when you might not have put much thought into what you were writing them. Remember, CDIs are supposed to be a support for clinicians, not a nuisance. Thanks, everyone. Bye.